This episode of The Dog Show features Shiva Greenhalgh. Shiva is a registered animal nutritionist and member of the Esteemed Nutrition Society of Australia. She holds a Masters of Animal Science, Animal Nutrition from the University of Sydney and a Bachelor of Science, Zoology from Western Sydney University. In the interview, we talk about chronic kidney disease in dogs, including what it is, how to know if your dog has CKD, and how diet plays a role in managing it. Shiva, welcome to The Dog Show. Thank you for coming on.
Thank you for having me.
I'm really excited to have a chat to you today because you're bringing a unique perspective to the listeners today. You've got a really in-depth experience and a lot of studying done in animal nutrition. So we'll get into all those meaty topics a little bit in a moment. But to kick things off, can you tell me a bit more about your dog?
Yeah, Mona. She's the Australian way of pronouncing it is Keeshond, but the more European way is actually Keeshond. And she is 2.5 years old, and I think she's here right now, but she's sleeping. But she's a really good dog. We got her mainly because they're a great breed for children. And they're a very sweet-natured dog. So yeah, that's Mona. Yeah.
Interesting. They're a fairly big size though, right? Or they just look that way because they're fluffy?
No, they look like that. They probably weigh about max 20 kilos.
Okay.
So she's about a medium. Yeah, she's a medium breed dog. Yeah, they're pretty much oversized Pomeranians.
Okay,
Yeah.
that's a good way to describe them actually
Yeah.
from the photos I've seen, yeah.
Yeah.
Is there anything unique about them apart from being good with kids, about their personality or?
Look, for me, it depends what you're looking for, obviously, in the dog, but for me, the children aspect was really important. I guess the only downside is that they do unfortunately suffer from anxiety issues. And despite all the training that you can do, this is just something inherent in them, but that's something that we can definitely accommodate as a family. But the children aspect is very important because children prod and do all these different things, and most dogs are generally quite okay, but this breed is far more tolerant than others. And so I want my children to be able to have a good experience with an animal that I can feel that I can trust. So yeah, but I guess any kind of unique things about them per se, they're probably not designed for the Australian climate. So and they do need a great load of grooming. So every 3 or 4 weeks we need to take her to the groomer just to get a de-shed and trimmings and things like that. And they absolutely love and need to be part of the family. So they can't not be around you, or they need to see you at all times. So that's a really important factor as well, that dog is literally by your side at all times. Yeah.
You must have your hands full with the fur. I imagine it gets everywhere.
It can, but it's not too bad. It stays on her pretty well.
Okay.
I think, though, that they go through a big kind of shedding phase, apparently 18 months. I didn't see that. But if you keep on top of just a brushing every couple of days of them, it's pretty good. Yeah.
I guess, as you said, if you go into the professional groomers on a regular cadence and also doing the brushing yourself, that kind of looks after it.
Yeah. But she doesn't like the brushing too much, but I think that's just her anxiety as well. But we got her used to it since she was a puppy, and that's something that you need to get onto ASAP. Yeah, once you get them. Yeah.
How old were your children when you first got Mona?
So I got Mona. Hold on. So I found out I was pregnant a month after I got Mona.
Okay.
And then but my eldest she was actually only about 2.5 at the time. And then I've had the cats as well. So Mona's grown up with my children. Yeah.
It's interesting, that decision around, do you get a dog before you have children or while you have young children, or do you wait till they're a bit older? Like, I think that's a decision a lot of people are kind of questioning.
I think for me it was good to get the dog when I already had my child.
Okay.
As opposed to getting them before. because it's important for them to also realize, I mean, this is my view, but that there is someone else smaller than you that is also part of the family. And animals, they do get jealous. That's a fact of life. And so, yeah, and also I wanted my child to, I guess, grow up with, I guess, a puppy stage, so they're a bit more comfortable. The dog is comfortable with children too, so something that they both get used to. Yeah.
Yeah, that early training stage is probably super important for
Yeah.
getting them used to the kids. Yeah.
But it does depend on the child too. Like my eldest is very sensitive, so it's important. Whereas my second child, she wouldn't give a damn whether the dog was there before her or not. She just kind of adjusts and adapts. So yeah.
Yeah, a lot to handle. Couple of cats, a dog, couple of children.
And I'm pregnant with my third one. So
oh, congratulations.
Thank you. So this one would just have to get used to everything too.
Yeah, exactly. Lots of different personalities and things to kind of weave together.
Yeah.
Okay, so why did you become an animal nutritionist? What did that journey look like?
That journey started at age 16.
Mm-hmm.
When I got my first ever pet, which was, I guess, a cat. It was my cat, Ollie. And before that, I was never allowed to have pets, it being a cultural thing. Middle Easterners hate bringing animals into the house. So I finally got this cat, and we knew absolutely nothing about animals whatsoever as far as what to feed. So we just went along with what the breeder told us to feed a cat, which was literally, most of them do say this, mince food, just a really straight out raw diet. And if there was any kibble, it was probably one of the worst quality ones that you could get. Don't want to name which one. So we went along with that for some time, and cats being cats, if you're not offering any kind of diversity, that's what they get used to. And offering anything else is just like it won't happen. But then I did notice, I thought it was very odd to me, because I guess growing up in our household, we ate everything and anything. So I was used to having like organ meats as a child and eating a whole variety of things. And I didn't see the difference with animals. And I saw that my cat over time was more susceptible to being sick. And he just seemed a bit more frail. And so this just got me really interested. And I researched a lot and about, are there nutritionists out there? Vets, they only know so much. They're kind of like with your GPs, and if there's anything further, they'll refer you to a dietitian. But there wasn't really that option. So we didn't get too much information from our vets. So it just kind of led me down this journey of how can I do it? And so my initial undergraduate degree had nothing to do with animals. I did an arts degree, but that was because my parents didn't want me to do anything with animals. And then when I guess got enough courage, I said to them, I finished that degree, but I don't want to do anything in that field. I want to go do animal science. So I did plan this, and I looked into what I had to do, and that was, I did a zoology degree. Then I went and did my master's in animal nutrition, went and got myself registered, and, go and doing different courses and things like that to keep myself updated, and now doing my PhD. So that's how the journey really started for me.
I'm glad that you made the decision to go with what you love and what you're passionate about.
Yeah, absolutely. I mean, it was hard standing up to your parents sometimes because they have their plans for you as well. So I'm not regretted at all that I didn't start it sooner. Yeah.
Yeah. And how's the PhD coming along? You finish next year, is that right?
Oh, yeah. So hopefully August of next year I will submit. But my PhD is in poultry nutrition.
Okay.
But it's all kind of the same. They're monogastrics. The same principles apply. So yeah, you have actually a lot of people that start off in agricultural nutrition that move into the pet industry. So yeah, there's a lot of overlaps with it. Yeah.
Okay. Well, it's safe to say you're highly qualified based on your experience from what you've just told us now and what I've read about you. So, but today you said you want to talk about chronic kidney disease in dogs,
Yes.
which is obviously quite a common and concerning problem for owners. But do you want to tell me a bit more about what that is?
Yeah, so kidney disease is probably the most common issue that I deal with dog owners. Is probably more common than people realize. I actually get more of that as an issue than even obesity. And so kidney disease is something that, so there's kind of two parts. You can either get acute kidney disease and chronic kidney disease. It's similar to humans. And it's essentially the kidney, it's functioning, but it's not functioning as well as it should. And it can take a long time for it to get there. That's why by the time people realize it, the dog's probably at a stage 2 or 3 out of the 4 stages.
Right.
It can happen to dogs at any age, mind you, but it's predominantly more common in older dogs, more smaller breeds, and it's pretty much where the animal, the kidneys don't function as well, so they can't filtrate a lot of the toxins that build up. A lot of the nephrons are damaged. And so they're needing to drink a lot more water. They're urinating a lot more to try and get rid of these toxins. And the kidneys just can't get rid of it. And so they just build up and the animal becomes quite sick. And so this just becomes a problem for them. And diet plays a huge role, because if you're feeding the wrong diet, you're building up more toxins in the body, which then damages the kidneys even further. So diet plays a big role in how long kidney disease goes for. It's not reversible, but we can definitely slow down that damage of the kidney through diet. Yeah.
What would cause kidney disease, or diet might play a part in that, or is it genetics? What else?
It's quite multifactorial. So there are some dogs where it is unfortunately a congenital issue, and I've had some dogs that they're not even a year old, and they've already got kidney disease, and they're probably at stage 2, stage 3. So that is a genetic factor. Other factors are other diseases. So it can be cancer, it can be diabetes, it can be autoimmune disease issues, and it can also be if the animal has had acute kidney issues. So if it's through a toxin, sometimes acute can be, I guess, helped, but sometimes it can progress into something chronic. And another one, which is an interesting one, which is probably not discussed as much, is dental health.
Right.
So that's what happens more maybe in the smaller ones, and cats. Cats get it a lot too. They're more prone to dental disease. So over time, those bacteria enters the body, and gradually it damages different parts of the organ, including the kidneys. So that's why it's really important for pet owners to, if you can brush their teeth, if you can start when they're younger, or if you take them to the vet once a year to get their teeth checked, do a basic clean for them, because that could be a problem for them later on, particularly with the smaller dogs or smaller cats. So yeah, so that's an important factor.
So that's kind of, I guess, a preventative measure, the keeping the dental hygiene. What about from a food perspective?
So really the food doesn't cause the kidney issue.
Okay.
It's more those diseases and those other issues. But what diet does do is that because the kidneys aren't able to filter out these, so protein is a buildup of protein, phosphorus, sometimes potassium and sodium. These are things that we need to kind of reduce, because this is where it can damage the kidneys further, because it's not able to filter it out quick enough, and so it builds up in the animal, and that's how they can become sick. So yeah, diet itself per se doesn't cause the disease. It's other things, but diet helps either progress it or slow it down.
Okay, so I guess the question I was going to ask is, can a dog live with kidney disease? And you're insinuating that yes, it's not curable, but they can still live managing the diet and things like that.
Depending on, it's not reversible. They can live with it. How long they can live with it is incredibly difficult to say, and I never tell people how long, because that depends on the animal, what other health issues they have, how old they are, how it was managed before, and what stage they're at. So, usually most people don't discover that their animal has kidney disease until it's about the stage 2. So there's 4 stages. And that's based off a series of different tests that they do, predominantly blood tests that are focused on checking for kidney disease. And sometimes they do like urine analysis. And so they kind of put all these together. And so there are very strict kind of guidelines of, okay, if it falls within these kind of value ranges, it's a stage 2, it's a stage 3, and so on and so forth. So it really depends on the animal and what stage they're at and any other underlying health issues. Now, you may have some dogs that seem like they're doing so well, and then it just quickly progresses for whatever other reason, and they don't last as long. So, it's kind of like you kind of need to check up on it every 2 to 3 months as well, these blood tests, to see how it's actually progressing.
So I guess like anything, I guess the earlier you can either catch it and manage it, then the better you'll be.
Yeah. And I think probably going into, you probably would want to ask, well, what are the symptoms? How could we pick up on this?
That was my next question.
And there are things, I mean, if most pet owners, they know their dogs so well, they can even pick up on slight changes. So the biggest thing is drinking more water than usual, urinating more than usual, loss of appetite. They're probably the biggest things. There's also diarrhea and vomiting. Pretty much you'll realize your animal's not feeling too good, but the biggest thing is how much water are they drinking, how much is their urine output. Some animals, they drink a lot, and you might think, oh, a larger breed's going to drink a lot more water, but you have to see, are they needing to pee a lot more and drinking a lot more? And the hours that they're doing, especially at nighttime, they may want to drink more water. So these are just little behavioural changes that you need to, even if you doubt for a bit, you go, oh, seems a bit odd, just go do a blood test. Yeah, don't put it off. Even if it's not chronic kidney disease, it's something else. So any slight changes, just go get it checked out. Yeah.
Yeah, and I think every owner, the way you would just like behavioural changes, every owner's going to know, how much their dog usually drinks, how much they usually urinate, that kind of stuff.
Yeah.
So you just got to watch out for, something that's out of the ordinary, right?
That's right. Yeah, that's definitely right. And don't think that it's silly or anything like that. Some people think, oh, maybe just today, and they justify it. They go, oh, we went for a big walk, or maybe I gave them too much kibble, there's too much dry food, so they need to drink a bit more. And also keep in mind, how old is your animal as well? As I said, younger dogs can get it. It's not as common, but dogs from about 5 years onwards, that's when it can start. So, yeah.
Interesting. And so you mentioned getting like retested every couple of months, based on like if you're trying to manage it. So that's kind of like, given a scenario, say for example, your dog was diagnosed with stage 2 kidney disease, which you mentioned is the most common time to pick it up.
Yeah.
And you're getting checked every 2 months. Like, is that, what kind of time frame are we talking from like diagnosis through to the unfortunate end, I guess? I don't know how to describe that.
Depends. Yeah, it's so hard. And your vet will also tell you, some vets, you could go, you first get diagnosed, the dog gets diagnosed, and then the vet might say to you, come back to me in 3 months' time. And this is all depending on what you agree with the vet or the nutritionist as to what they're going to eat. So I always encourage people, a lot of clients come to me because they're like, oh my gosh, this is such a bad situation. I want to cook. I want to do all of this for them. And that's good. But I would also recommend that they go on a commercial diet. And please note, I don't work for any of these businesses, but what I do know about it is that it is well formulated to help control it. And if you can have some kind of insurance policy, which it is, to ensure that it's going to slow the progression with that kind of food, because sometimes we're not able to always cook or ensure that it's balanced for whatever reason. You may have other things to do, and you might not be able to do that batch that week. At least you have some backup. So depending on what, I guess, diet therapy you're going to go with, your vet might say, okay, stage 2, you're going to go on this diet. Maybe we'll come back in 3 months' time and we'll have a look at it then. Some vets might even say, depending on the progress, 6 months. So that's, your vet will decide. But typically, 2 to 3 months is, I guess, an average thing that people go do. They get tested. but it all depends on the progress generally and what the diet's like and the age of the animal and so on and so forth. Yeah.
Okay, and what are some of those? I mean, you mentioned there's obviously commercial foods which are designed to remove the things that you don't want your dog to be eating when they have kidney disease. Is that right? Is that what you're saying?
Yeah, so it's typically low protein diets. People say low protein diets for CKD. That is also not a good thing. You don't want it too low.
Okay.
Moderately low is good because they still have a need for protein. Um, you just don't want it to build up too much because there's this obsession of we need to give our dogs a lot of protein and so there would be some foods you need to avoid like organ meats and the way that you cook it as well. So boiling is the best way because it demineralizes the food, and by that we're reducing the phosphorus, we're reducing the potassium, and these are things in kidney disease where the kidneys struggle to filter it out, and so it builds up and the animal feels sick, they don't want to eat, they're lethargic, they vomit. So these are just toxin build up as well. Yeah.
Okay. Okay. So
Yeah.
if I had to summarize like what we've spoken about so far in terms
Yeah.
of preventative measures, like keeping dental hygiene really good is important.
Yeah.
And then in terms of just looking out for any behavioural changes such as more urinating, more drinking,
Yeah.
potentially diarrhea or vomiting as well as
Yeah.
signs that there's something not right, and you should go and see your vet. And then obviously, if you are diagnosed, then it's about changing the diet as one of those management, I guess, mechanisms. Would that be a fair summary? Is there anything that I'm missing there?
Yeah. And also, I guess the other thing is sometimes some dogs are quite prone to urinary tract diseases. And so if a dog is prone to that, like they've had a few, then they're more likely to later on develop kidney disease. So that's just something that people should be mindful of as well.
Mm.
But yes, you're right. Essentially, looking out for those behavioral changes and then going on changing their diet to a kidney friendly diet is really the best way and in looking at it. Yeah, but with preventative measures, unfortunately, and people blame themselves a lot, but a lot of it is out of their control too.
Mm.
As I said, there's genetic factors, there's other diseases that can come into it, which the person has no control over. It's just unfortunate that some dogs they just get this disease. Yeah.
Oh, well, it's very I guess it's good to hear that there's things you can look out for and ways that you can, live a good lifestyle with your dog, such as the dental hygiene and things, just to try and prevent it as much as possible, even if there is the odd occasion where, it's not possible to kind of avoid kidney disease because it sounds like it's quite common and genetically based.
Yes.
So, I mean, that's just life, I guess. But, I appreciate you sharing all those great tips today, Shiva.
Of course. Of course.
More like so. Moving on from kidney disease,
Yeah.
what are some other reasons that people would come and see you as an animal nutritionist?
Yeah, people come for a whole host of different issues, other kinds of chronic illnesses. So we have diabetes, or some animals are just very fussy eaters. And then some people just generally, they're so overwhelmed by all the information that they get, they don't know what to feed at all. So anything to do with nutrition and pets, people come to me. I have vets come to just clarify about certain pets that they're looking after, whether this is a good idea. Some animals have so-called allergy issues, or some people just want to do home cooked, but they want to do it correctly because imbalances do occur. So for a lot of people, it's more a clarification of what they're doing is correct or needing to get on the right path. Yeah,
Yeah, that's a
for
good.
what to feed. Yeah.
That's good to know. We actually we do a home cook for our dog because of she had lots of allergy issues as a puppy,
Yeah.
and wouldn't take to pretty much any commercial food that we tried. So
Yeah.
had to start home cooking. But maybe I might need to give you a call just to make sure we're doing the right things.
Of course, please
um,
do. Yeah.
but anyway, where should people go to find out more about you and your practice?
Yeah. So my business is Sydney Animal Nutrition. I was doing some face-to-face where I do home visits, but currently I'm just doing Zoom or phone consults. So yeah, you can go on my website and my details are there. Yeah.
Well, I guess that's good because then people that aren't based in Sydney can still, get a
Yeah.
session.
Right. That's right.
Great. Well, I'll share your website in the show notes and everything so people can go and check it out.
Thank you.
Great. Well, thanks so much for coming on the show today, Shiva. I really appreciate it.
Thank you for having me.